Let's stay with the issues around PPE. Joining me now, Dr. Jenny Vaughan from the Doctors Association. Doctor, good to see you this morning.
Hi, Bill.
We heard from the Deputy Chief Medical Officer a couple of days ago that the United Kingdom was an international exemplar of preparedness when it came to PPE. What's your view of that?
I think at the moment we have to accept that we are in the middle of a pandemic and that these are incredibly challenging times. However, that having been said, the Doctors Association and I would say probably fairly confidently the whole of the front line of the NHS is extremely concerned at the level of preparedness. We really believe that this could have been dealt with better if we had prepared better, we had noticed, and we actually agree with some of the comments that I've just been hearing about, we're the first people who've called actually formally for a public inquiry, and there's an ongoing petition about that. And the reason for that is not about apportioning blame. It's actually, if we can actually look at what happened, it can actually mean that we don't do it, it doesn't happen in the future. Now, the problem we've got is that it's absolutely true that people are having to resort to making their own scrubs, sourcing their own scrubs. We have an app that we launched several weeks ago, and the really concerning thing that things having got better when the government brought the army in, we can now see things clearly getting worse again. Now, we accept that we've only got 1,500 doctors, which is a very small snapshot of what's going on, but it's a remarkable snapshot. And what it tells us is that 75% of them are telling us they don't have access to gowns, and nearly 40% of them have not got access to eyewear. We're actually having to work with 3 firms as an organisation ourselves who are actually using that data to be part of the solution. So as an association, we are trying to be the part of the solution and fill the gaps and get PPE deliveries out to the front line. So all over the country, you can see examples of amazing British, manufacturers trying to get in touch, trying to solve this problem. There has been a disconnect from the government, not only in admitting that preparedness could have been a lot better, but also there seem to be a lot of these companies reporting back that they haven't been able to get through to NHS procurement, and they've had to take matters into their own hands with frontline staff and do their own deliveries. We have great concerns about all of that and whether things could have been done better. We are where we are now and we're going forward, but we're very concerned about the future. We're very concerned about to hear plane and where that's going.
Okay, Dr. Vaughan, I'm going to have to interrupt. But just we heard from the government minister on the programme this morning that in terms of PPE, the NHS will not run out. On the basis of what you have just said, it seems that at least in isolated pockets, it already has for some frontline staff.
I think he would have to explain why. We're aware of companies who have had 600,000 requests for PPE from the front line. Why there are these, there's no denying that, and why we have continual data coming through on our app, which is reporting from the front line of gaps. Yeah, and we also are hearing very concerning things like over the weekend, we nearly ran out of gowns. We're dependent on supplies from Turkey, which haven't arrived that. When the front line hears that, of course they're going to be concerned. We passed a tragic milestone yesterday of 100 healthcare workers who've died on the front, who've died. Now, not all of those are related to looking after patients on the front line. We accept that. But when healthcare workers see that, they see their colleagues getting sick, some of them are tragically looking after them on ventilators, and they see the stories about things potentially running out, they have a great deal of concern and would find it very hard to believe what we're hearing from government. And as I said, we are very concerned about the disconnect there. We need the government to get a grip of this tragedy. We need to get the government to get a grip of this situation, and we need it now in the name of patient safety and also staff safety.
Indeed. In terms, though, of the burden of responsibility for provision of protective equipment, how much rests on central government? How much rests on the individual NHS trusts?
Well, there is no doubt that the main responsibility for preparedness on PPE and pandemic preparedness has to be with the government. We know that in 2016, all sorts of recommendations were made about preparedness, and we have concerns that the stockpile of PPE was run down and there's a problem with things being out of date, although some of those can be reused. The NHS trusts are actually doing their best to try and supply their staff. We have no, apart from staff taking things into their own hands when they are concerned, we've got no evidence that NHS trusts themselves are trying to prevent PPE being delivered to their staff. In contrast, they're doing their best. However, there are gaps. There is an clear lack of preparedness here. And at the Doctors Association, that's why we're calling for a public inquiry. But more than that, we would like to learn the lessons now, because as doctors, when things go wrong, we have to learn lessons quickly in real time to put it right. So that's why I'm saying, and that's why the Doctors Association is saying, if you get a grip now, you can look at why these problems are occurring and regain the confidence and the morale of the front line. It's not too late. We need to see these promises lived up to, because we're not seeing them at the moment and we don't have the confidence that we need.
Dr. Jenny Vaughan, good to see you this morning. Thanks for being with us, and I hope you and your colleagues stay very well indeed.